use a scoop or some other instrument like a hook to scrape the ear canal and bring the skin in. Now, I just wouldn't do that with my patients. It'd be too uncomfortable for them. It'll traumatize that skin. And even if it didn't, with this particular case, it's not that consistency. It's mushy, it's macerated. It's not going to come away like that. And you can see there, I described it to a patient almost, I gave the analogy, if you've got a stamp on a really dried stamp on an old envelope and you're trying to peel that away, or if you've got I mean, that's probably the best analogy, because the other analogy I was going to give, if you've got a bottle and you've got a label, but that bottle is a lot sturdier. An envelope is a lot thinner, so as you're peeling that stamp away, you want to bring it away, but then you don't want to traumatize the envelope itself. And that's what we're trying to do here. But of course, it's in here, so it's going to be more challenging. And I've just bent the tip of the fine end, and I'm just gliding it now in the back part of the ear canal, right to the eardrum. To be honest, the patient could hear very well at the moment. The reason for removing this is because they had extremely dry, itchy ears. I wanted to remove as much debris as I can. So they're going to, after the appointment, they're going to go to the pharmacy and get some acetic acid spray. That's until they can get to their GP, because then they will need some prescribed medication, most likely going to be Otamize. So Otamize, it's a very popular topical antibiotic spray in the UK. It can work very, very well. Otamize contains 3 active ingredients. You've got an antibiotic, more specifically an aminoglycoside, and it's called neomycin, and these aminoglycosides, they are ototoxic. So if you've got a perforation in your eardrum, you shouldn't be using them. And they end in mycin, so erythromycin, streptomycin, neomycin. There are some examples of them: gentamicin, streptomycin. So MICIN or MYCIN, that's what these medications, group of medications, end in. And what aminoglycosides do, so within the skin cells, or within all of our cells, we've got obviously the nucleus, and you've got other organelles like mitochondria, which is the energy source in the cells. You've got Golgi apparatus, you've got ribosomes, and they all perform different functions in the ear. So we've got ribosomes in the ear, and there's 2 sections of these ribosomes. One section helps to connect aminoglycosides, and the other section, it reads the the DNA code, and it goes off to get different amino acids in the particular order, so that the other subsection of the ribosome can then connect the chain of amino acids to create a protein. So what the aminoglycosides do, so these antibiotic drops and neomycin, it connects to the ribosome, so it prevents the amino acids from being joined up. So if you've got bacteria in your ear and they want to reproduce, they're going to pass on the genetic code within the cell and reproduce via the ribosomes. It's going to tell the ribosomes, this is the genetic code to create more bacteria to reproduce itself. So you need to get these proteins within